Good evening, everyone.
Good evening, ma'am.
Welcome to the day 3 of National Nutrition Week Awareness Campaign. I welcome you all. Thank you for joining us today. And you all know today's topic is lactation nutrition. So, are you all ready for the discussion and for the insights? Good evening, Maishri. Okay, so let's get started. So, before I start the topic of the day, let me share an incident which happened way back in 1997 when I was doing my BSc in nutrition, where my nutrition teacher has came to my to our class, and before starting the topic for that day, she asked the entire class one question: what is more important, the nutrition for a mother, the nutrition for a lactating mother, or the nutrition for a pregnant woman? Which one is more important according to you is a question asked by my nutrition lecturer. What do you think is the answer, guys? Use the chat box. What is more important as per you? A pregnant lady is more important or a lactating mother is more important in terms of the nutritious food that we give? Vibha says pregnancy. Okay, I need more responses. Okay, Prashanti says, okay, Shaida says lactation. Both are important. Afrin says, of course. Samata says pregnant. Okay. So we got a glance of it, right? As you all did, so we just proudly said it is pregnancy which is more important. But to all of our surprise, 30 years before is the incident that I'm sharing to you all today, that it is not pregnancy, it is a lactation phase, which is much important than being pregnant. Do you think is an eye-opener? So both the things are important, but lactation really requires a lot more nutrition to the mother during that phase of a period than pregnancy. So starting with this note, let me introduce you all the speaker of the day, Dr. Rupinder.
Thank you so much, Jyothi, ma'am. Hi.
So as we all are saying that lactation phase is more important than pregnancy, maybe it might be a shocker to you all, but this is a fact. So having said that, let's hear from Rupinder why lactation phase is so important, why it is so crucial. Over to you.
Okay, thank you, ma'am. So lactation phase is very important. We all have heard that when a child is growing, that adolescence phase, number of hormones are playing their roles and things are changing in their body. Everyone knows that, but no one talks about the changes that occur in a woman's body once she delivers a child. So that is the thing we are going to emphasize on this day. And lactation phase is important for the baby as well as mother. But why? The thing is, the mother is now nourishing her own self. The mother is nourishing her own self, and along with that, she is nourishing the child with her milk. So that is the thing that is the most important here. And the other thing I would like to tell you, so you all have heard about DHA, in that Bonvita ad and everywhere we are seeing DHA is used for brain development and things. It's also for visual development and a lot of things it's required. But if the mother is not nourished properly during the pregnancy and during the lactation phase, the postpartum phase, it is not available in the maternal milk. So maternal health is important. And like that, vitamin A and a lot of micronutrients, macronutrients are provided with the mother's milk to the baby. So that's why nourishing her in that phase is much, much more important than the pregnancy part.
Wonderful. So that's where we start with. So as we go on, we'll talk more about why this space is important, what are the various myths and taboos that we come um, across various castes and various regional practices. And let's see, because we keep observing, being our own colleagues, being our own friends who belong to the same nutrition fraternity, I still see people suffering during these phases because there is a lack of awareness at the family level. Though, as a nutritionist, a woman might be knowing certain things, but unless otherwise, this awareness levels goes to the family level, then to the community level, then at the national level. We cannot bring on change. That's the reason, even in spite of knowing things, people are unable to bring up changes in their own lifestyles. Having said that, one of the most, you know, uh, it really disturbed me a lot. Like, there is a lot of restrictions given to the lactating mother, the new mother. Okay, so let's talk upon that. Like, I have heard most of my friends when I was living in abroad, they don't even give them enough water to drink. And I have witnessed incidents like, in Europe, tap water is drinkable. Since they deprive so much of water, the women, the mothers, they have no choice. They just go to the bathroom, they drink the tap water. The level is to that extent. So let's talk upon this, Rupinder. Like, what do you say? Why people deprive of this water, and what is the advice that you want to give to them?
About water, everyone knows actually that water is important for us. Our body is made around 60 to 80% approx amount of water, and it is required for the all the food we are eating, for that nourishment to, our body can absorb it properly, function properly. So water is required. And another thing I would like to add on is, um, when a woman is feeding, when a lactating mother is giving milk to a child, she loses 25 ounces of water a day when she's feeding the baby. That is approximately 700 ml. So if we are not giving her the hydration, we are not giving her the water, then how the feed would properly come out from her? She won't be able to feed the baby. And even ahead, when we go, we can see the milk is initially diluted, then thickened. So even the milk is that much sophisticated. Our body is that much intricately designed by the God. It knows that baby requires water, but we can't give it directly. It is going through your feed. So it is utmost important to give the female a water, because it would help in hydration, it would help in better nutrition, better sleep, and a lot more. So that is the reason water is required. We can't follow any traditional or cultural thing without knowing the diet, food habits, and the pros and cons. We can't blindly go ahead with everything. So that's my points, Jyothi ma'am.
Yeah, definitely. Wonderfully put it across, Rupinder. So, guys, the information, the takeaway point you is like, most of them, they think that by not giving enough of water, they'll get the milk in a more thicker consistency, which is a totally a wrong notion. So please do not get into these kind of practices. Please nourish the new mom. It is most needed phase than pregnancy. So having said that, there are a lot of restrictions that are given to the food choices, to the food that people serve. So what do you say about that, Rupinder?
So the food choices, we have heard about a lot of things. We are not going to eat this or that. Like, some areas brinjal is stopped, and in some areas, like, we are not allowed to have lady finger, saying this one is hot, this one is cold. And some area they are not giving chicken, they're not giving protein. But the thing is, what diet the women was having, what was her routine basically during pregnancy and before pregnancy. Normally in the area where I live, I have seen people not giving chicken because it is very, we say it is hot, like heat producing kind of thing, and the woman is not in that phase. We can give her that much, it would increase the warmth, the heat wala type in her, the cough Vat Pith thing. So, but I have seen people who are eating chicken after the second day of delivery because they have eaten that from the starting part of their life. So we just can't go ki everything is fitting into every person. Like every person is differently designed. So their diet, what they need to eat, how their body is nourished, it all depends on every single person's diet, the way they are eating, the area they are living. We can't fit a single shoe in everyone's feet. So the same way, we can't put a single like this is a cultural thing. We are following these practice from a lot of time, from long back. So we'll blindly follow it. So you need to change. You need to nourish yourself. You can't just say I can't eat this because my great grandmother wasn't eating. Their time was different, your time is different, their needs were different, your needs are different. So just hear that, just feel that, just listen to your body. It tells you the best what is good for it.
Okay. So as she rightly said, yes, there are a lot of cultural practices, region-wise practices. So if you come down to the south, I've seen practices. If you go up in the north, they feed something like Gondka laddu. No, for 21 days, every single day, they have to eat one laddu each day. They think that that will strengthen the muscles of the mother. Where you come down to the south, 21 days, they deprive you of curd, saying that this will produce cold to the baby. So I'm just giving a glance of examples, but I am here, evidence based, telling you all. I delivered my daughter normally at 8:42, and in the labor room on the same bed, they served me full breakfast, and I had it happily.
And Jyoti ma'am, one more point, they are not giving milk to the mother, and they are putting tea, in it, and they are putting coffee, and then they are giving. So that is also one thing people are doing. So milk is milk. Even if you changes its color, it doesn't change the nutrition, it's milk. You can give it directly to the female. There is no problem, she needs nourishment. So
Correct.
give her proper nourishment, what her body needs.
Team, please mute the participants.
So,
Guys, please mute yourself. We will take you.
options
you please do
tradings
this?
కాదే
ఇట్లాంటి స్ట్రాటజీస్
Jyoti ma'am, you are muted.
Yeah. So it is very important to understand what is actually the practices are. There's so many age-old grandma practices which has a scientific reason behind. We are not against that, and we full-fledgedly, wholeheartedly follow most of them. But when something is concerned about the health of the women, we have to bring up certain changes, which is the need of the hour. So before you jump in, at least I want the mothers, the young mothers who are becoming the sufferers most of the time. I want you all to become more vocal, talk about it, discuss it, maybe bring up some change. And if there is any no thing which you need help, you please need to consult either a lactation specialist or a dietitian, which is widely available in India. So having said that, the story doesn't stop there. No, there are many issues more than food issues. There are a lot many issues which the new moms face. The moment the baby is born, totally from the 9-month full-fledged focus from on to the mother, the total shift becomes to the baby. No, everybody is concerned and taking care of the baby, and most of the times the mothers are ignored. And there are a lot many issues which the new moms face, just be body shaming or postpartum depression or nutrient deficiencies, or it could be n number of things. We can keep on adding one on down. So why not you throw some light on these aspects?
Okay. First of all, I would like to say about the body shaming that I have seen a lot, and especially female doing that to another female. You know, the mother-in-law or the family member of the mother is like telling her, you know, she is putting that seed into her mind कि अगर अभी नहीं हुआ तो कभी नहीं. If not now, then you won't be able to lose that weight ever. So that makes that mother a bit vulnerable, you know, because as Jyothi ma'am told, attention is very less on her. Like from 100%, it merely is 20%. And then hearing words like this that you didn't lose your baby bump, like people think that the baby bump would vanish when the baby is out. So that is not possible. It stays and it takes time, but that time is not I can say the correct time to say that you have to lose it. That time is to nourish the mother, you know, to care for her instead of just body shaming or judging her, because it becomes the female becomes vulnerable. There is fear. What fear would lead to? It would lead to decrease in the milk production. And then she's again blamed that the milk is not coming. You are not able to feed the child properly. I told you to eat this and that. Then you are making her anxious, fear, anxiety, stress, everything is coming and the production is again getting less. So these things affect them. And then there is another thing we are hearing nowadays, postpartum depression. So what actually it is, they are baby blues. And if you are not aware of the baby blues, it happens to 80% of the women, women having a perspective that we are going to feel whole, loving, that kind of feeling when the baby has come. But there is nothing like that. In fact, they are having sleepless nights, they are not able to eat properly, they are having pain, they are not able to adjust to the schedule of the baby. And this happens to every woman. Like it's almost like from a few days to 2 weeks. So it's quite normal because there are a plethora of emotions in her mind, from happiness to joy, fear, anxiety, things are going on. But the thing is, we need to take care of her in that time. About this we are going to talk ahead, but now the issues part we are covering right now. And another issue we are having is stress, work stress, lifestyle stress, how she's looking, that kind of stress, the clothes aren't fitting, that kind of stress. So at that time she just needs a handhold of her partner, her caregivers, her families, her friends. So that is the only thing she requires. So these are the big issues everyone is facing nowadays. I can tell about this.
Okay. And also I can add on one more, probably you can talk about that also. Mostly when the milk productions is not that good, or like people, you see most of them, they don't pump their milk. So in that case, how do they know that whether the milk is sufficient or not? And people keep judging on that too. That brings up a lot of stress on the mothers, thinking that they are not able to feed their babies properly. So what is your opinion on this, about advice you want to give on to people?
So on this, there are a lot of perspective of the milk is not coming out or it's not properly getting pumped out. So usually things what I have seen in my time during the hospital service I have given. So what happened is when the mother delivered the baby, she is unconscious. So she's not in a conscious state to feed the baby. So what people do is they just go and bring the formula milk and they feed that with a spoon to the baby. And it's easy for a baby to suck. But when the mother comes up and the baby has already filled his tummy, because no one tells you how much he needs, he isn't going to stop. You're going to feed 3-4 teaspoons, and is that his big tummy needs that much kind of thing? No, it's just a small tummy. It's just like a size of, we can say, bear hota hai na? I don't know, Nirja, Jyothi ma'am, what do we say bear in English? Sorry.
It's a kind of berry.
It's kind of a berry size, and then the mother comes up and then you ask the mother to feed him, and why he would latch on. First thing, the mother doesn't know how to latch on the baby doesn't know, and on second hand, baby's tummy is filled up, and no one is guiding her which position and things, and the mother is not in a fully conscious state, a lot of things are going in, and sometimes it's not initially the milk is not coming up, even if she's trying to pump, she doesn't know how to pump it out. But going through all those factors, no one supports her, no one tells her it's okay, just give yourself some time, just calm down, just breathe in, relax, and it would come out. But everyone is putting pressure on her, and then at the end again they say milk is not coming out. So a lot of things are going in that perspective also.
So this is so true, and I definitely would love to add my bit of little story here. Like when I delivered my daughter, it was morning, and of course, this was in Switzerland, guys, where they have world-class maternity services, the best in the world. Nothing less than that, not even a single word less than that. Given that case also, my lactation did not start immediately. It took quite a lot of time. And my midwife, she was behind me all the while to give a formula feed to my baby. So I was totally against her. So I was really in a big argument. Like I kept on telling her, let me try. Let me try. If it doesn't happen, we'll see later, but I want to try. So the lesson, the important message I want you all to take is, because of lot of stress, it's all hormonal surge. The initiation doesn't happen. When the baby latches, when that support, when the baby suckles the mother's breast, that's what brings up the action in the body and triggers the milk production. So I used to tell her, I will feed her for half an hour. It's okay. Let the milk not come. You take her and give her later. But I'm not going to let you do before. And by third day, by second day, she fed off. She fed off and she came to me and she said, okay, let me weigh the baby. She literally weighed the baby before I gave her feed. And she weighed my baby after I gave her the feed. And she said, there is 200 grams difference. Yeah, now you can feed. So why I'm telling you all this story is, you do not get these kind of restrictions, not only from family, the medical system, the midwifery system, people. There are no lactation specialists at Switzerland. They don't even give birth to babies. So they have no idea, though it is world class. So it is very important to understand that you might find these kind of, restrictions even from the medical fraternity. Let's not get surprised if that happens to you, and you all have to get equipped to fight for yourself and your baby. Having said that, I took a lot of time, but let's bring back to the discussion. So how can we bring a change at the society level or at the family level? How can actually we can bring up a change in this? What can we do?
A lot of things can be done about it. First, the mother needs to take the responsibility for her own self and her own baby. Yesterday we were talking about the pregnancy diet, and before that we need to plan everything. Our vitamin levels and everything should be good. So there is also another aspect, like mental and emotional aspect, which women can make much better. She can start meditating, she can start like breathing properly, so that she remains calm. When she remains calm, it helps her to go through that pregnancy phase, and especially that labor phase, and after that delivery phase, she's much more calmer. So she can use the word plays, the power of thoughts or the power of words. So for example, how to do that, I can tell you, just remember a single word. Like every day from initial days of pregnancy, she can take a one word. Like, for example, I say welcome. So after brushing, she can just look into the mirror and say, welcome. I welcome all the sensations that bring my baby into this world. When she practices this every single day, the day her labor day is there, and they are taking her for the labor, and she just remembered that word, welcome, her body would stay calm. She would remember that thing which she practiced every single day. For that day especially, she trained herself. to remain calmer in that time. The other thing can be practiced is undisturbed birth. So we have seen animals, mammals, and everything. When they give birth, they give that in a silent place where no one is there, for that privacy, for that relaxation, warmth. So they can ask their husband or, their family member to be with them, and she can just breathe in, breathe out, and relax her, calm her down. Just give herself a pep talk that she can go through this, that I can do it. Because when the more calmer you are in your labor, the less painful they are. So that is how she can connect to her own self. And then she can have a very simple thing, a mindful meeting with her baby. So, just when the baby has come, when we go to the rooms, consulting them or telling them do these things, there is a lot of things going on, a lot of noise. Everyone is happy, tears of joys, and a lot of, plethora of emotions. So what I did during my hospital time, I told all my patients to practice this. Some did and they felt very good. I just told them during the delivery, just give yourself a moment. Just ask your husband or your family members to quieten and give you a quiet space. So what she did in that quiet space, she just pick her baby. Anyone can place it on her chest. The baby was on her bare chest. The baby was bare, skin, only diapers or only that hanky or langot people used to make the baby wear. They were having that. And that was the golden hour of her and her baby. And she was crying the tears of joys. And, this skin to skin touch, or it's also known as kangarooing. What it does is, for the mother, it increases its milk production. When you have skin to skin contact, oxytocin is released, which helps in your milk production, which helps in your happy movement. It increases your happiness. And for the baby, it helps him in regulating the temperature of his body. It kind of sinks in with your body temperature. His breath regulates. And in some cases, what the patients told me, they put the baby on their chest and the baby crawled till their breast and latched on her or himself and start sucking. So this is the magic of that golden hour. That is your bonding time. You need to give that time to yourself. You waited long for 9 months to see that amazing miracle in your hands, and now he's there. So just give that moment to yourself. The other thing which can be done, which would make them more happier and more merrier, can be a mindful feeding. So, nowadays we see this, you are feeding or you are doing any multitasking is the new era of this time, So stop that. Just switch off your TV, switch off your phone, put it aside, hold your baby in your hand and bring it closer to your chest, let it feed. And just feel your body. It would feel tight in some areas. It would feel soft in some areas. Just let your body talk to yourself. Just see this amazing creature in your hand, which you gave birth to. His face, his tiny nose, his eyes, his hands. And, you yourself will start feeling that happiness. And at the end, you can just pay a moment of gratitude. So this is what a mother can do for her own self, for her own mental, emotional, and all the aspects of holistic health for herself and her baby especially. And the support. There is a support we require from society. First of all, we were talking about baby blues or the postpartum depression. So why it occurs? First of all is sleep, lack of sleep. The mother goes from sleepless night during her pregnancy phase to this phase, especially adjusting to the schedule of baby. So what the family members can do, or her spouse or the caregivers can do, is when she is just going for and eating a meal or showering or doing her emergency or necessary course, they can take care of the baby. And when she has fed the baby sleeps for 3 to 4 hours, and sometimes at a stretch 4 to 5 hours, she can sleep while the baby is sleeping. It's not enough though, but smaller naps also help, because lack of sleep is the biggest factor which leads to depression. So it helps her and she feels supportive. because the people around her is also giving her importance, not only the baby. That a feeling of I'm also important is there within her. She feels good. And then the next thing is nourishing her properly. She needs proper food, she needs proper meal. I would like to add a story here. So what happened with me, I had a patient and she contacted after 1 week when she came to a pediatrician for her baby checkup, and she told me, ma'am, just call my mother-in-law and ask her ki you didn't took the diet chart. And I did the same. And when she came, her mother-in-law told me from 1 week she is just giving her 2 bowls of dalia whole day and hardly 1-2 glasses of water. And then her mother-in-law is complaining, milk nahi aa raha, doodh nahi aa raha, and everything. And I was astonished. I mean, what you are giving to the mother? Her skin has gone pale. And it took a lot of convincing for a half an hour to 1 hour to tell her the importance of food and to tell her, give her these things. So it takes time, but when you educate them properly, their mindset starts changing. So that is necessary, because we also give, like people are saying ki add other things like ginger water, ajwain water, methi dana pani, and a lot of things. These things work, but they not only they would work, they work in combination with proper diet, proper hydration, and proper rest. They are just small factors, but the main thing is her nutrition. So you can consult your doctor, you can consult your dietitian for the proper guidance. They can send you to a dietitian or the lactation experts for that part, but don't become your own dietitian. Okay. First and last thing is this, and the other part, the most important, body shaming. Don't just tell them ki you need to lose weight and this and that. Let her go with the flow. So when you let her go with the flow, after 2 months, 3 months, when she feels it's okay, her body is restored, she's healing properly, she can start with a walk, or you can consult her physiotherapist or anyone you want, someone to guide her properly. You can consult, but don't tell her from the first day, start doing household chore or just start walking, start exercising. It wouldn't work. So, and one more thing I would like to add is here what happens. So here the most important part which a mother-in-law can play, a mother can play, a friend can play, a husband, the talk part. What happen is, like we have seen in mammals, in animals, when they give birth to their babies, they're independent. They don't depend on anyone to feed them, to run, to take them here and there. But a human baby, he is dependent on us. He's dependent on his mother, on the caregiver. So here what happens, God gifted us a hormone known as oxytocin, which gets released when the mother feeds the baby. So I would like to explain a very simple mechanism with the help of this hormone. So just imagine this hormone has a pull and push kind of function. Okay. What it doesn't push, it helps in push emotion. Like what it would do, oxytocin would get released. It would tell you that your milk production is increasing. You are having a loving bond with your baby, this miraculous creature you give birth to. But at the same time, back of your brain, there is a thing going on. You are in your past. I had an amazing body. I had so many hobbies. I used to exercise so much. I had a job. All of that is gone, and you are lost in your own thought process. So what role hair society can play? Every mother, either it's your mother-in-law, either it's your mother, either it's your any of the near and dear ones, they had gone through this phase. Ye phase chala jayega, but you need to talk. The females need to tell their story. They need to talk. You need to talk to your husband, tell them what you are going through. You need to share. The talk is the most important. I would like to add a dialogue here. So I think everyone must have seen Ye Jawani Hai Diwani movie, one of my favorites movie. So usme hai Nana and Bunny. Everyone knows Ranbir Kapoor and Deepika Padukone. So Nana tells Bunny, ठीक है जितना मर्जी ट्राई कर लो, लाइफ में कुछ ना कुछ छूट जाएगा, तो जहाँ है वही के मजे लो ना. So that is the, I can say, the thing I want to tell you. This time you are in this motherhood phase, embrace that motherhood. Don't just go into that past part. Ye reh gaya, wo reh gaya. Embrace this phase and then you can start. Nothing is going anywhere. It's only your mind is playing tricks with you. So just enjoy this phase. These are the support we need to give our own self and from the society. That is all, Jyothi ma'am, I would like to convey from my side.
Wonderfully put it. I just love it. Just need to add two. This is one side of the coin. I want to actually add one more to the other side of the coin also. There are people who are on to the work. As Rupinder said, do not insist them on too much of physical labor. They need time. But on the other side, there are also moms who don't even get up from bed for the first 6 months. So that is also not good for you all, because a little bit of activity, and if not, we are not asking you to exercise for us, but at least you should get up while you swing your baby, while you talk to the baby, while you want to do yourself a little bit of, you need a little me time for yourself. That's what brings up a change in whatever is existing. For that also you have to get up from the bed. First of all, do not lie down, don't stay sedentary. A new mom is not a patient, it's a period to enjoy. So I want you all to stay active. There are many mothers, I can quote myself as an example, who managed from day 1 of pregnancy till 8th month of my baby all alone. There's no support system because I was a faraway land. But you can get equipped with all the techniques how you can do this so well. So I want all you moms to be that smart enough, learn to be self-equipped so that you're not dependent on anybody. When we are not dependent on anyone, that brings up more confidence. One day if someone is not there, what will happen to me? How will I manage? And the panic situations. Just imagine how many of you have gone through this. So all these things you can avoid when you all are self-equipped, along with the self-love and support and other stuff, which beautifully Rupinder has explained. So that comes to the end of today's talk. And if you have any questions, please use the chat box or you can unmute and talk to us. So meanwhile, there is one question from Mohana, Rupinder, for you. Yes, ma'am, I heard in many cultures, they avoid ginger and garlic as it adds strong flavor to the milk. Is it true?
Okay, so
what is your take on this?
Okay, so basically what happens from our area where I am here, they are giving ginger water, they say it's good for mother's health. It increases the milk production and everything. So it's just like, it's a very simple thing. Mohana, right? Jyothi ma'am?
Yes.
Okay, it's a very simple thing. If you believe it would affect you in some corner of your brain, you think it would affect, so don't have it. But I think 2 pieces of garlic in a whole dal making for the whole family, it won't affect anyone. And you have been taking that garlic since pregnancy. And the mother milk starts its storage from that pregnancy time. So if the garlic and ginger thing would be, it would already be in your milk, So there's nothing like that. It's just things are starting from long back, and some have good significance, some have good backed up with science, but some are just one said and the other believed, and then that no one has answer to it and it's continuing. Hamare bade karte the thing is going on and on and on. So at least you need to question it. And if you think it is not harming, you can change it. But if you slight have a trust, so don't do it.
See, I'm an example of a person who drinks my ginger tea twice a day, every single day. I don't give it up. And there is a tradition, especially in South India, where they give this exclusive garlic powder as the first morsel of your meal. They think that is a heat producing food and it actually enhances your milk production. Of course, there is a taboo behind, but there is a practice. But I think all these things can be on until the moment the mother likes to do this. No,
And
that is
Jyothi ma'am,
important.
here it's called soont powder, and it's also added to the gund laddu, to the panjiri, and to everything that is made for the lactating mother, you know.
Correct. So there is a few more questions. Wait 1 second. Let me read out for you. Okay. I don't know who's this Oppo, but the question is what to do if anyone faces breast cancer, then how to give milk to child, or in fact, any chronic disease which affects the breast. It's not specified.
Okay. So for that, I think you need to consult your doctor. So they can suggest you much more better situation is you basically I tell you breastfeed can be given it's nothing like that you can't give it to anybody, but in some conditions doctors say not to feed the baby. So it's better to consult your doctor before giving feed to your child if there is something like this condition. If he agrees, you can go ahead. Otherwise,
Yeah.
don't experiment, It's better to take advice.
So it basically depends on the stage of cancer, whether they are taking the treatment or not, at what stage of treatment. Like usually, if it is already done phase, and in fact, feeding helps in reducing the risk in most of the cases. But again, it's case dependent. So these kind of things has to be individualized. We cannot give a generalized opinion on this, but yeah, get an opinion from your doctor, and you can definitely get back to your dietitian with that what doctor has suggested, then we can definitely look into it and can answer better. So there is a question from Selomita. After C-section, that people believe that consuming dal can cause some pus, so they avoid protein source, which mainly help them in healing those stitches. What is your take on this?
This I have heard about this, and even the same thing goes with milk. They also say that milk will create pus, but ma'am, there is nothing like this. Protein source is required for the women at that time. Even the soups and stews you are getting served in the hospital, they are also made of dal, and dal is the best source at that time. Especially the moong dal, it's so light. People advise that you should add that in your soups and in your daily routine. So there is nothing like that. It wouldn't create pus. You can surely have it. But still, the same notion, if you have that thing in your mind, it would create pus, don't have it.
And to the breast cancer question, there is an input from our dietitian, Sirisha. I'll read out that for you. So it is usually advised not to breastfeed during or for some time during chemotherapy, especially. See, again, that radiation or chemotherapy, what kind of treatment, that's what we exactly said. But if it is chemo, the drugs, there is a chance that the drugs will pass through the mother to the baby. So that's when the doctor usually says no. But if there is heaviness of the breast because of not able to feed the baby, there is always a scope to express and throw it out. But again, it depends on what kind of treatment protocol the mother is in. Thank you, Sirisha. So there is one question from Sonia. I'm suffering from thyroid, ovary cyst, and weight loss due to thyroid. So how can I cure it and put on my weight? Okay, not a question relevant to lactation, but would you like to answer that? She says she has ovary cyst and thyroid, and she lost weight. Is it hyperthyroidism, Sonia, or because
I
you're
think
losing weight
this
and she
would
wants
be
to
if
put
she
on
gets
weight?
more specified and we look into her routine and reports. That would be a specified and better answer for her than being just seeing this part.
Probably we'll come up with a session on thyroid. Then we will talk on this, Sonia. Okay. Okay, she says hyperthyroidism. Okay, and there's a question from Sagar. If mothers are having more milk production, I mean, if milk secretions are more, what should they do? Give your view, ma'am. People just more
you
enjoy
can
the surplus.
pump out the milk. You can pump out the milk and store it.
Yeah,
It's a thing that is good in Western worlds, but not in our country. So the milk can be pumped and stored.
Yeah, we
But
can do that.
don't heat it before using
We
it.
shouldn't. We
Just
shouldn't. You get something called milk warmers. When the breast milk is expressed, if you have lots of milk, you can express and donate. There are milk banks. there are agencies which make jewelry with milk, breast milk. You can do that is most precious thing. You can do a lot more if you have surplus. If you have really more, once you express it, you can use it within, if it is kept at room temperature, you can use it within 4 hours. If
Jyothi
the mother is busy, she has to go to some shopping or do something for herself, she can put the same milk in bottle and give it to her family. It becomes a great thing. Expressing
even
milk is a
nowadays,
boon.
even nowadays, protein powder are also made of it, especially, and they are quite like costly and
Correct.
precious.
Correct. And there are donation agents, like there are mothers who want to buy breast milk. And if you really have surplus, please go and give it to them. They even offer you big amount. Or there is one more idea from my side, like you can express every single day, pack them or bottle them, put a date on it and keep it in the freezer. Once it is in freezer, you can use it for 2 more weeks. That comes as a planning later. When there is a little decline in the milk production, you can use later. Okay. So a lot of inputs on breast milk. So I think there were no more questions. And thank you so much, Rupinder. It has been such an insightful and interesting talk. And it's a never-ending talk for us, I know. But it's time to wind up. Okay, there is one more question. A person who faces with arthritis on HCQS, can she feed the child? HCQs are
hydrochloroquinones. They are given for rheumatoid arthritis.
Okay, so would you like to answer this?
Yeah, I mean, like rheumatoid arthritis, HCQs are given, but usually they are not. I mean, like HCQ usually initially people used it for malaria. Okay, so as a prophylactic also people use it, and HCQ, if mother is taking and it gets into the plasma and obviously it gets into the mother's milk, and I don't think it is a problem for kid. If at all the pediatrician or the gynecologist are aware, they would be the right person to suggest. Okay, and it is not the job of dietitian to talk about like what kind of drugs are expressed in mother's milk and whether they're good for baby or not. So I don't think, I mean, personally, because I'm a doctor, I can say, but the gynec and the pediatrician are the right person, because the dosage, whether it is getting into the mother's milk or not, if you are not sure, then obviously we cannot talk about that. It is again a general question. If it is a specific thing, if the mother is suffering with rheumatoid arthritis for so long, obviously, and for how long they are on HCQs. Okay, so that is also important, whether it is getting into the plasma, the concentration, and usually hydrochloroquinone gets excreted quite easily, but it is an alkaloid. So some people, they say that, okay, it is better not to give milk if you are on HCQs. But again, it is the call should be taken by either pediatrician or gynec.
Thank you, sir. So thank you all guys for joining us today. It has been such a beautiful session. So we have gone through pregnancy, then we have come to lactation. So tomorrow's session is going to be about infant nutrition. Today we spoke all about the mother. Tomorrow we are going to talk about exclusively about the baby. So Sirisha, can we have the complimentary exercise sessions link in the chat box? And also please put the WhatsApp group link in the chat box. So guys, on the account of National Nutrition Week, we are offering complimentary exercise sessions in the morning along with these nutrition sessions. So those who are interested, please click on the link and register with us, and you will get a link personally to your chat box and join us, and we'll see you all staying hale and healthy. So just stay for a while. Yeah, the link is there. Just click upon that and see you all tomorrow. Have a good night till then. Great to have you all. Thank you. And thank you, Rupinder, so much.
Thank you so much, Jyothi ma'am, for having me here and giving me the chance to share my insights about the topic.
Yeah, it's been really, really great.
Thank you,
Lovely
Rupinder.
discussion.
Thank you, Jyothi ma'am, for your insights.
Thank you so much, ma'am. Thank you.